Good evening, everybody. I'm Dr. Joseph Baker from the Liver Chiropractic Center, and we're going to be talking about arthritis tonight. We're going to be talking about what is it really. In fact, for many of us, we sort of joke about it. When the Arthritis brothers, when they come to visit, they never go home. They're never leaving again. We banter around so much about arthritis, and many people, every time a joint is uncomfortable, a joint is painful, they call it arthritis. Well, tonight we're going to talk about what is it really? Like many things, if we don't define it well, we really don't have an understanding of what we're up against and what it is that it's going to take in order to create that solution for each and every one of us so that we're able to, send the Arthritis brothers going packing, So tonight we're going to talk about a few of those things. We're going to laugh a little bit. We do have a bunch of serious information to cover this evening. And one of the things I do want to remind you of is that, in the end, this is information that everybody needs to hear. Everybody needs to be aware of. Regardless of whether you're a chiropractic patient or not, does not matter. This information pertains to each and every one of us. So regardless of whether you're on the East Coast, which is where the Liver Chiropractic Center is, or around the world, this information, these truths hold true to each and every one of us. And I'm asking you to make sure that you're sharing this information so that it doesn't just stop here. That hopefully somebody else gets to benefit from you engaging in the next 20 minutes, 25 minutes, and in turn is able to be helped without it costing us absolutely anything other than to just simply like this, leave your comment, and share this information. Because here's the reality, and unfortunately these statistics are staggering, and I'm only going to share this one statistic with you. 80% of adults over the age of 65 have been diagnosed with arthritis. Now, you have to forgive me, but that's a really important statement. Reported, diagnosed with arthritis. See, the problem is that means that somebody has actually taken a picture or done blood work in order to help identify the fact that this is actually present. It's not enough that you stand there and say, "Doc, my arm hurts when I go like this, or I feel, a little ache in my back." No, that's not it. They've drawn blood, they've taken pictures, they've looked inside, and they have confirmed that this is actually present. And like I said, this is a staggering number, but we recognize that, there's so many people out there that suffer from arthritis and yet have no idea some of the things that are actually at their disposal to help themselves. And that's why we're having this conversation tonight. Because ultimately it's about releasing the anchors. Releasing the anchors that keep you guys from doing the things that you love to do, and in turn allowing you to live life the way you desire. And ultimately that is the goal, is that we get to take control over a small part of what we know as our health. And we know if we're doing our part, then this system of ours just simply functions so much better that the possibilities are endless. And that's what I want for each and every one of you. So when we start looking at arthritis, we start talking about it, there's two very, very different types of arthritis. Now, one is what's called osteoarthritis, which is, basically, it's a mechanical type of arthritis. Now, sometimes it's known as degenerative joint disease. Sometimes it's just abbreviated OA. It's mechanical in nature. It takes a mechanical problem to create this, to start this, and to produce the destruction that we eventually get to see. Now, the other type of arthritis is rheumatoid arthritis, which is a little bit different, and we're going to talk about that because rheumatoid arthritis is that type of arthritis it's defined by the fact that it's an autoimmune problem. It's a chemistry problem inside of your body. And the only way of truly diagnosing this is to draw blood. To actually draw blood and find that rheumatoid factor inside of your bloodstream. Now, presentation-wise, yes, there's some differences between the two. Rheumatoid arthritis, generally speaking, affects both sides of the body. It loves the fingers. You oftentimes see people with fingers and toes that are going sideways, but it's always balanced. It's always affecting two sides of the body. Osteoarthritis has that opportunity of affecting a singular joint because it's not mechanically working the way it's supposed to. So in turn, having the understanding of the type of arthritis that you have helps tremendously in formulating the choices that you're going to take. Now, if you've been told you have arthritis and you're not sure what type of arthritis you have, pause now. One of the very first things that you need to write down is the fact that you need to make sure that you're getting checked to know the type of arthritis that you have. See, knowledge is power, and knowledge gives us the ability to know where we're at so that we can take the proper action steps to get to where we want to go. But if we don't know where we're at, well, how can we create the roadmap to get to where we need to be, where we desire to be? It makes sense. And yet, too many people, when they're asked, well, what type of arthritis do you have, they're not 100% sure. And unfortunately, when you have rheumatoid arthritis that's just starting out, it can mimic, it can look like a lot of the same type of presentations as osteoarthritis. The more advanced it gets, yes, rheumatoid arthritis looks drastically different, and there should be no confusion whatsoever between the two of them. Now, if you've never seen what arthritis looks like inside the body, these are great pictures. These are great images of that from the standpoint of, the gnarly hands, the big knuckles, the fact that we've destroyed the cartilage that's all over the surface of these joints. That's supposed to be nice and fresh and moist. And when we have arthritis, it looks like somebody shot at it with a paintball gun, where it's not that same fresh color, where unfortunately it's broken down, where sadly what used to be this nice moist structure that's supposed to be there is gone, never to be rebuilt exactly the way it was created from birth. See, the sad thing is that oftentimes this can be prevented. Because in the end, if we know how arthritis actually forms, how it starts in our body, well, guess what? That gives us that ability then to make sure that we're taking the proper steps to prevent the breakdown, to prevent the damage, to make sure that we're never, ever going down that road. In fact, I was just at the dental office the other day, had my teeth cleaned, and my dentist does teeth in a day. He's a periodontal specialist. He is used to taking all the teeth out of somebody's mouth and putting brand new teeth in their mouth so that they can once again have a full set of teeth to live the rest of their life with. Now, the reality is that most times it's preventable. Most times it's preventable where you don't have to lose your teeth. There are many people out there that live their life with their teeth that they were born with, that they were given, and they get to grow old with them. And yet there's others we've seen poor choices produce that bad outcome where in their 20s they've lost all their adult teeth. Where it starts eroding to the point where, unfortunately, they just have to have them, the rest of them, ripped out in order to start afresh with implants. And I'm reminded of it because, you know what? Arthritis inside of our body is exactly the same way. See, if we're doing our part in maintaining the body from birth on, arthritis doesn't have the opportunity of necessarily forming. We get to prevent it. Now, many of you, we started this conversation out as, what is it really? Many of you are asking yourself, so exactly how does arthritis start to form? And listen, right now we'll talk about arthritis in the spine, but this same process really stands true with pretty much every other joint. The very first thing that happens when we start to look at the mechanics of the spine, which is supposed to be in a nice straight line from behind, and we're supposed to have nice 45 to 60 degree curves from the side, and whether we're talking about the neck, the mid-back, or the low back, it doesn't matter. If those are there, the body is going to be maintained the way it's supposed to. It's going to function well. But when we have a subluxation, when the bone comes out of place, the very first thing that happens, unfortunately, we start to lose our posture. When we see those subluxations and those bones coming out of place, our posture shifts. Now, almost simultaneously, one of the other components of the subluxation, that bone coming out of place and putting pressure on the nerve, is the fact that the joint doesn't move properly anymore. It actually causes the joints to jam together. And when it does so, well, that excess pressure on the joint, not very welcome by your body. Yes, it'll deal with it for a while. But over time, what happens is what's called Wolff's Law. Now, we've done a whole workshop on Wolff's Law. We've talked about it before. I would encourage you to go back, find it, and review it, because I'm going to tell you, it answers the questions of so many different problems within our spine regarding arthritis and osteoporosis, and how it is that you can use that law of nature to your benefit to reverse those things. Now, in the spine, once we've lost that alignment, once we've jammed those joints together, Wolff's Law kicks in and arthritis starts to form because of the constant pressure on those joints. And when we add more pressure than is supposed to be there, your brain starts producing more bony deposit in that area. It is a law of nature. Your body doesn't care whether you believe in it or not. It's going to happen every single time. Oh yeah, by the way, because the joint's not moving properly, we also don't pump nutrients into the disc, and at which point, all of a sudden, that disc starts to wither and die. The remarkable thing is that degeneration, it happens slowly and insidiously over time. It could take years, if not decades, before it actually is visible on your x-rays, the effect of that. But the sad thing is as it's slowly eroding, we recognize, unfortunately, we don't always get to wipe that clean. This is why I said the best way of addressing arthritis is never to let it form. But that's how it happens. That's how it's produced. In fact, we could spend hours and hours and hours just talking about how it is arthritis is formed in the different joints of your body. But one of the things I want to do is give you the tools to help you, to make sure you know some of the things that you're capable of doing to help yourself. Because it's not enough to know, hey, listen, I got this problem. Well, that's great, doc. I got a problem. Help me solve my problem. And I'm going to encourage you to leave me a message in the comment section to tell me what your action's going to be. Because as we look at these 5 different things, listen, each and every one of us can engage in all 5, but I want you to record just one thing that you want to share that you're going to do. And one of the very first thing that's on this list is controlling your weight. We know every time that we take a step, 3 to 5 times our body weight goes through the joints of our body. The knees, the hips, 3 to 5 times our body weight. Now I'm going to encourage you, just sit there and calculate it. How many pounds of pressure is that every time you take a step? Oh, there's a reason why we do your weight balance. That we want to see that you're within 3 to 5 pounds as far as balance is concerned. Because we recognize as you start to glide to a side and you start carrying more weight on one side of the body than the other, not only does it make it difficult for your spine to allow for the healing process to take place, but all of a sudden you're damaging other joints so much more rapidly. Ask yourself, why is it that your right knee just bothers you and your left knee doesn't? Why is it that when the weather turns, all of a sudden that knee or that ankle starts to talk to you? This might be one of those reasons. You're carrying excess weight. And when you start running, then let me tell you, that amount of pressure goes up exponentially. So in turn, if there's any one thing that you could start with, I would tell you this is that one thing. The more you control this, the better it is. Not just for your spine, not just for arthritis, but for every other system of your body. Now, the next thing is exercise. It sort of goes hand in hand with controlling your weight, but I'm going to tell you, controlling your weight has got more to do with the food that you put in your mouth than the exercise that you do. Many of you, that's that biggest thing. You've got to push yourself away from the table first to control, because you can never out-exercise what you're eating. Now, don't get me wrong, exercise is critically important. And then when we're talking about preventing arthritis, one of the worst things, one of the most damaging parts of the subluxation, that bone being out of place, is the lack of the joint motion. That lack of motion causes other problems, just like a domino, to form. And when we're talking about arthritis, lack of motion, being sedentary, is awful. Just like a car. If you're not running that car periodically, let me tell you, stuff breaks down without even putting miles on the odometer. Your body's the same way. You need to get up and move it. You need to move it, move it, move it. Because if you're not moving it, you're definitely losing it. And the Arthritis brothers, they're taking over. So one of the very simple things is, listen, get up, walk. You figure out what you're able to do. Most of us are capable of getting up, walking around the house, getting outside, walking up and down the driveway, down the street. Some of us, we can actually engage in more rigorous forms of exercise and activity. You want to engage to a level that you feel comfortable. Because here's the thing. The minute we stop is the minute our body starts going backwards. We need to continue to fight the good fight. If you're able to get in the pool, it's an excellent way of working these joints with a limited amount of stress on those different joints, on those different body parts. Now, along with the exercise is the anti-inflammatory diet. This is critical. Inflammation, arthritis, I-T-I-S at the end of that word. Inflammation, that's what that is, itis. Well, listen, why would we want to be dumping stuff into the body if we know it's going to make it worse? Last time I checked, kerosene and water, both very clear. They're going to have very different effects, though, when you throw them on a fire, aren't they? Well, guess what? Not all food is created equal. Some is going to drive us into an inflammatory state. Others, it's going to drive us into an anti-inflammatory state or an alkaline state. You need to do your research to understand which foods are which. Now, if you need help, I'd be more than happy to supply you with a couple of the lists of foods that are better choices. And yes, just because they're raw fruits and vegetables doesn't mean that they're all great choices. If you have arthritis and you know you have arthritis, let me tell you, the nightshade vegetables are not your friend. Can you eat them? Yeah, in moderation. Tomatoes, potatoes, eggplants, peppers, it doesn't matter. If you're eating them, guess what? You're driving your body into an acidic state. So maybe, as you're looking at this anti-inflammatory, means of helping yourself reduce some of the effects of the arthritis, you want to make better choices. Stay away from those inflammatory foods. Cutting down on red meats to, 2-3 times a week. Making sure that you're drinking enough water for your body. Because let me tell you, if you're not getting rid of the waste, the byproducts, yes, you will have toxic overload. Oh, and I've heard all the time, from patients, I don't need to drink water. I'm okay. Well, let me tell you, your body is definitely going to argue with you on that. 75% of your body is a water molecule. Last time I checked, if you're using a resource and you're not replenishing it, pretty soon you're going to get out of balance. Bad things happen. So in turn, making sure that you're consuming enough is doing your part in making sure that you're reducing the toxic overload that oftentimes will create your arthritis to feel worse. Now, minerals are one of those things that most patients and most of us really don't even think about. Here's the thing. If we're eating really good fruits and vegetables, if we're consuming whole food nutrition, we're getting a lot of these things. Now let's do reality. How many times a week do you eat now? Consuming alcohol, tobacco, caffeine. See, the problem is that oftentimes, as we're consuming different things, well, we're taking those resources that we're bringing in and we're decreasing the benefit or the effect of it. Because maybe our body can't get everything out of what we're putting into it. Maybe because we're consuming things like, cereals and processed foods. Well, just because it says fortified with, doesn't mean that it's a really good choice, and doesn't mean that your body is able to absorb the nutrients out of it. So I'm going to tell you, as we look at this list, whether we're talking about calcium, magnesium, copper, zinc, there's times when, maybe we need to consider utilizing supplements. It's not ideal. But the problem is that the foods that we consume, even the good stuff, even the organic fruits and vegetables that we consume, let's recognize, they're not the same as what was once grown 50 years ago, 80 years ago. Well, that's not me. The government's already done this. In fact, the research isn't new. It came out of World War II. Let's understand the fact that we're producing stuff, foods, that are supposed to be feeding and fueling our body, that are devoid of most of the nutrients that we need to have. And the sad thing is that sooner or later, if we're using our body like a piece of machinery, a piece of equipment, we need to make sure the resource is there so it can run the way it's supposed to. So it's able to help defend us against what needs to be done. Maybe that's one of those things. And for each of us, we need to look at how we consume, the choices that we make. Because in the end, those choices, they make a huge difference. Just like maintaining your spine. Oh, don't get me wrong. You can stop chiropractic anytime you want. You just have to decide the level of maintenance that you choose for that spine of yours. See, in the end, we recognize that maintenance is always a choice. Caring for this body of ours is always a choice. Do we have to show up at the gym? No. But we know what's going to happen next. Yeah, we're going to start losing muscle tone. We're going to start gaining weight. A whole bunch of other stuff's going to happen. Oh no, we don't have to maintain our spine. Just like we don't have to maintain our teeth. We don't have to brush our teeth. We don't have to do our exercises. We don't have to do our tractioning or, present to just simply get checked. But in the end, this bad accumulation continues to build and grow over time. And the sad thing is that the only choice we have is deciding, well, do we want to maintain our body and our spine in good shape, or do we choose to wait and for a crisis to happen? See, the sad thing is that for many of us, we've seen it far too often, where friends and neighbors, they just simply wait. They wait for crisis. And they wonder, why does it take so long to overcome? Why does it take so long to get out of pain? How come this is nagging me when I used to be able to rebound? Well, guess what? Like most individuals, most chiropractic patients, and maybe you're one of these individuals, the average chiropractic patient is 50 years of age before they ever have their very first spinal check, before they ever start to maintain that system of their body. And they wonder why in the world they have arthritis when they're, a mere 600 maintenance adjustments behind schedule. I don't know. It seems very clear to me. And yet, it's a choice. It's a choice because oftentimes they don't know the options that are out there. They don't know what you know about chiropractic. In fact, one of those very first recommendations I always ask our patients to follow through with is to be the example. Show up for your adjustments. Follow through with your care plan. Make sure you're doing your home exercises. Make sure that you're doing your tractioning. Be the example to others first. Because in turn, by being that example to others, it is going to be that most precious gift that you can give them. To demonstrate the outcome of making the better choices, the better decisions, and having those anchors released so that you're able to get up and get out and do the things that you want to do. So many of you have been asked the question, what is that one thing that you really want to do that you haven't been able to do because you have this problem, these subluxations? And it's remarkable hearing what it is that you haven't been able to do. Even more remarkable is knowing that when you follow through with what your responsibility is and you do your part, how well the body works and how you're capable of getting back to doing the things that you love to do. So I'm going to ask you the really big question tonight, which is, what are you going to do? You've been given a list of 5 different things with a lot of different examples there that give you the opportunity of picking and choosing, well, what's the one thing? What's that one thing that you're going to engage in order to help yourself? Maybe it's your diet. Maybe it's the amount of water consumption. Maybe it's the types of foods that you're picking and choosing. For some of you, maybe it's just simply the exercise, just getting up and picking a form of exercise that you feel comfortable in doing. For others, maybe it's making sure that you're getting back on track with your chiropractic care and with your spinal maintenance. See, in the end, I know as you share this information, we get to create accountability in our Facebook family. One of our friends, one of our neighbors, one of our loved ones gets to see the things that we're working on. They not only get to encourage us, but we get to ask them to come along on the journey and maybe possibly refer them to that most right next step for them, which is just simply getting checked. I'm Dr. Joseph Baker from the Limerick Chiropractic Center.